Yes.
Yes, sir.
So you can start your video.
Yes.
Right. Are you ready?
Yes, sir. Ready, sir. Yes.
Yeah. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting a speaking session. This is a role play session 6 of Syed Farhan Ahmed from Wakra, Qatar, originally from Chennai, Tamil Nadu, India. He's preparing for his medicine specific occupational English test. These are the daily dosage profession specific speaking materials and medicine profession specific speaking tasks. This is the card. You can go through it for a minute or two because you have already prepared
Yes, sir.
if you want. Otherwise, when you are ready, you can start.
I'll start, sir. Yes.
Yes, you can start now.
Good afternoon, sir. I'm your current consultant physician in the emergency department. How is your son? I believe he was admitted 2 hours ago in view of viral gastroenteritis he was diagnosed with. And I,
Yes, doctor, you are absolutely right. My son's name is John. He's just 4 years old. I am his mother, and I came here, yes, 2 hours ago, and 36 hours after recurrent vomiting and stomach pain. And he had a viral something interest, something I don't exactly, I'm not clear about it. He was kept in for 2 hours.
I'm sorry to hear that. 36 hours is kind of a trouble, and it would have been difficult for your child too to suffer from. I believe to counter the hyperemesis and stomach pain, he was hydrated with the rehydration fluids. If I'm correct.
Yes, he was on oral rehydration fluids. Yeah, you're absolutely right,
Yeah,
doctor.
and since you have been under he has been under observation for 2 hours, and he has responded very well to the treatment and hasn't showed any adverse effects. I firmly believe that he's fit for discharge. I hope you're okay with it.
I actually have some concerns, doctor. Can I ask
Yeah,
you?
sure, sure. Please, please.
I actually still do not understand really what this gastro or viral gastroenteritis is. Can you please further explain me?
Sure. Gastroenteritis. The word gastro means stomach, enter means bowels, and itis is referred to as inflammation. So gastroenteritis is infected inflammation of the gastrointestinal tract, that is the stomach as well as the bowel. It is caused by any pathogen. It can be viral or bacterial or even parasitic. But currently, your son is suffering from viral gastroenteritis. If you don't mind, can I explain you how it is spread? If you
Yes,
have time.
doctor. How did my son get this viral gastroenteritis? That is a big question which I want to ask you.
See, I believe your son is 4 years old, so he must be very playful, and they won't be much regular with their hand hygiene. So one basic concept of spreading is through contact with infected people. Like it can be in the form of vomit or feces, means by shaking hands with someone whose hands are not clean, who hasn't washed their hands after eating, or by even consumption of contaminated foods and objects which are infested with such pathogens. I hope I was clear uh,
Yeah,
to you.
my son looks very weak. I really think he needs to be kept in the hospital for some more time. Okay, I don't understand why you want to discharge him so soon.
I appreciate your concern and I do understand how you're going through. But see, as far as he has responded very well to the treatment, as soon as we found out that he's having viral gastroenteritis, and as soon as we diagnosed, we immediately took measures. We hydrated him. We rehydrated him with oral fluids, and also We have even given him some unsweetened fruit juices, etc. But it's written in the notes. So I feel he's responding well to the treatment, and there have been no side effects. So he's good to go. And I think the medications which have been prescribed to followed at home, that will be enough. But it's your duty that he follows those medications as well as he's taking regular fluids and water.
Yeah, that's
I
my
hope
concern, doctor. I am worried about taking my son home. I just don't know what to do if he starts to feel worse at home.
it's nothing to worry. I understand your uh, concern. See, basically, your problem is how to deal with it when something happens at home. So, for that, we have concerned specialists, by general practitioners who will guide you. I would suggest you to seek medical advice through them. They will. It's a step-by-step approach. It's just a few minutes of session. They'll first counsel you regarding the signs of dehydration, like the causes, the features, the clinical features, and the symptomatology of this dehydration. Like it starts with extreme thirst, then the patient starts to get lethargic, becomes irritable, and certain physical changes like the sunken eyes, dark circles, and etc. So he'll counsel you regarding that, and then afterwards he'll tell you how to be compliant with the treatment prescribed by us, like those antibiotics, and most importantly, the fluids. He has to regularly drink a lot of water. Apart from water, he should drink unsweetened fruit juices, and that's it. I think this might be sufficient enough for you. Are you satisfied?
Yeah, I feel better about taking my son home now that I know what to look for and when to come back to the emergency department. Thank you very much, doctor. That was nice talking to you, and
You're
I
welcome.
really appreciate your care and concern.
Thank you. No problem. It's my duty. Good to serve
Yeah,
you.
yeah, that's very fine. So, you are quite confident today. I think you have used some good standard vocabulary, and then apart from that, you are using some, special type of, sentence formations. I have noticed a little bit better than the earlier ones, earlier speaking sessions. Definitely, you are doing well. I think the practice which you have done earlier is going to help you these days. Okay, today. Help you today, I feel. That's quite. What do you say? Was that any benefit for you?
Yes, sir. It was of great benefit, sir. I referred to the C1, C2 vocabulary as you had mentioned, and I referred to that. I prepared also. I reviewed my sessions personally through YouTube, and it was of great help, sir.
So you watched your YouTube sessions and you have seen, noticed how you are dealing with your sessions, how you
Yes, sir.
are faring with your speaking role play cards and your warm up sessions. Yeah, revising your plays will tell you where you are lacking in and where you are strong.
Yeah.
Okay, where you have to improve and where you have to work on to expand, where
Yes.
you're at a weaker side. So
Yes.
consolidate your stronger points
Yes,
and
sir.
enhance your weaker points
Mm.
and work out on your average things also. So these
Mm.
three things, and mainly when you watch your own videos, you will see the way how you are presenting your body language, your mannerisms, your eye contact, and your focus, and then many other things, your way how you react to the situations, panic or confident. So all these things you can notice there.
Yes, sir.
Yeah. So that's fine. I think you have noticed a little bit of improvement today's session.
Yeah.
Right. Yeah,
Mm.
that's fine. Thank you very much.
Thank you, sir.